Benedict test. To perform the Benedict test, we require some apparatus. At first, we require a test tube. Then, this is a test tube stand. This is a test tube holder. This is a graduated pipette. As you can see here, this is a graduated pipette. This is the Benedict reagent. And also, this is a urine sample which is basically present inside the beaker. And also this dropper is used during performing the test. This is a burner. Now perform the Benedict test. At first, we take a test tube. Then we take the 5 ml of the Benedict reagent in it. Let's take 5 ml of the Benedict reagent in the test tube. After taking the 5 ml of the Benedict reagent in the test tube, the next step we have to add 8 drop of the urine sample in the Benedict reagent. Now take the 8 drop of the urine sample in the Benedict reagent. Now hold it firmly with the test tube holder. Just look here that we hold the test tube firmly with the test tube holder. Now shake the content well for 1 to 2 shake the content well for 1 to 2 minutes. Now after a proper mixing, we use the burner to flame the content. Now after mixing the content well, means the Benedict reagent and the 8 drop of the urine sample is now mixed well and it is held firmly with the test tube holder. Now basically we flame it with the burner. Okay. Now before use the burner, you have to careful about that. The opening of the test tube should remain opposite to your face. Either when we will use the burner, this test tube, the content inside the test tube, basically it will flame out and basically it can reach to your face. Okay, let's heat the content in the test tube. Just wait for see the color change. Waiting 1 to 2 minutes, you can see here that there is a formation of the color change occurs. This is a brick red color. As you can see here, this is a formation of the color change occurs that indicates this is a positive Benedict test. Means some reducing substance or the reducing sugar is present in the urine sample. Look the formation of the color change. Let's discuss some Viva questions which are related to the Benedict test. Now what is Benedict reagent? Now this Benedict reagent basically it comprises of the 3 components. As you can know that the 3 components are the sodium citrate, the sodium carbonate and the copper sulfate. Now copper sulfate is a source of the cupric ions. Sodium citrate basically it will prevent the precipitation of the cupric ions, and the sodium carbonate basically it will give the alkaline medium. Now come to the next question. What is the principle of the Benedict test? Now The principle of the Benedict test is in hot alkaline medium, the reducing sugar, basically it will give tautomerize and it will give the enediol. This enediol being a strong reducing agent, basically it will reduce the cupric ions into the cuprous ions, means the cupric hydroxide, which is basically the yellow color, it is changed into the cupric oxide, which is red color. Now come to the some clinical case. Now Benedict test is basically related to some clinical case, and the first clinical case is the diabetic mellitus patient. In the diabetic mellitus patient, the Benedict test basically it is used as a point of care testing or POCT, and also it is called the bedside testing. Now what happens in the diabetic mellitus? In diabetic mellitus, basically when the glucose crosses the renal threshold, which is practically 180 mg per deciliter, this glucose comes in the urine, and when this glucose comes in the urine, being a reducing sugar, it will give the test positive. Now another some sugar which is basically reducing sugar which will give the test positive. Another reducing sugar are, we can say this is the galactose, lactose, maltose, all the sugar which will give the test positive. Now the sucrose basically don't give the test positive because it's not a reducing sugar, because in sucrose the functional group are busy in the bond formation. Also the starch and polysaccharide also don't give the test positive because they are the high molecular weight and their functional group are also busy in the bond formation. Now come to the next question, that why Benedict test is called the semi-quantitative test. Now you can look at that after performing the test there is a formation of color change. Based on the formation of the color change, we can approximate the amount of the reducing sugar present in the urine. If there is a formation of the blue color, there is no reducing substance or reducing sugar present in the urine. If there is a green color, then there is a less than 0.5 gram % sugar is present in the urine. 0.5 to 1 gram %, this is the yellow color. 1 to 1.5 gram %, this is the orange color. 1.5 to 2 gram %, this is the red, and greater than 2.5 gram %, this is the brick red color it appears.